You know, one of the most frightening moments for any senior or their loved ones is that sound. The sudden thud, the pause, and then silence. It's that heart-stopping moment when someone has fallen. Your mind races. Are they okay? Did they hit their head? Can they move? What do I do? When a fall happens, the very first instinct most people have is to move quickly, to try to get up and prove they're okay. But Japan's oldest doctor teaches that the most important thing to do in that moment is to stop. Staying still and focusing on your breath can make all the difference between a safe recovery and a serious injury. When the body experiences a fall, it goes into a sudden state of shock. The heart starts to race, adrenaline floods the bloodstream, and the body's pain signals become temporarily muted. In that brief window, you might not feel the extent of the injury, which is why moving too soon can be dangerous. The body needs a moment to process what just happened, and that's where staying still comes in. Imagine lying there, your mind spinning, your breath shallow. The first thing to do is to take slow, deep breaths. Inhale through your nose, exhale through your mouth. It might feel strange to pause in that moment, but this small act helps your nervous system calm down. Breathing deeply restores oxygen to your brain, reduces panic, and allows you to regain mental clarity. Once you start to calm your breathing, you begin to shift from panic mode to awareness mode. This calmness is exactly what helps you assess your situation properly. While you stay still, start doing a gentle mental scan of your body. Begin with your head. Do you feel dizzy, confused, or in pain? Move your awareness to your neck and shoulders. Is there any stiffness or sharpness when you try to move your eyes or head slightly? Continue to your arms and hands. Can you feel them? Do your fingers move normally? Then check your chest and abdomen. Are you breathing comfortably, or do you feel tightness or pain when you inhale? Move down to your hips, legs, and feet. Can you wiggle your toes? Do you feel pressure, warmth, or pain anywhere? The idea here is to let your body speak to you before you speak to it through movement. Often in the rush to get up, people make injuries worse. A minor sprain can turn into a severe tear, a small fracture can become displaced, and a bruised hip can end up bearing more weight than it should. By remaining still, you're giving your body a chance to stabilize. The Japanese doctor explains that even a few extra seconds of stillness can prevent long-term damage. Those moments of patience can save months of recovery later. As you lie there breathing slowly, you also give yourself time to notice your surroundings. Maybe the surface is cold. Maybe you fell near something sharp or hard. You can take mental note of what caused the fall. Was it a rug, a slippery floor, or a misplaced object? This awareness can help you avoid the same risk in the future, but for now, the key is to remain composed. If you live alone, this pause gives you the clarity to remember where your phone or alert device is. Instead of panicking, you can reach for help safely and efficiently. It's easy to underestimate how powerful this first step really is. Most people think action means moving, but in this case, action means pausing. That stillness gives your body the respect it deserves after a shock. The doctor often says that breathing is the bridge between chaos and control. When you fall, chaos happens in an instant, but control returns with every calm breath. Once the initial shock of the fall has passed and your breathing is calm, the next most important thing to do is to check your condition and communicate for help. This stage is where awareness turns into action, and it must be done with patience and clarity. Japan's oldest doctor often explains that communication after a fall is not a sign of weakness. It's a sign of wisdom. The body might seem fine in the first moments, but internal injuries, sprains, or even mild concussions can be hidden beneath the surface. That's why checking yourself carefully and letting someone know what happened is essential. Begin by looking at your body, starting from the top. If you can, move your eyes and gently turn your head to check for any visible injuries or swelling. Pay attention to your arms, wrists, and hands. These are often the first to take the impact when people try to break a fall. Notice if there's pain, numbness, or difficulty moving them. Then look down towards your legs and feet. Do they feel normal? Is there a sharp or throbbing pain anywhere? If one limb looks slightly twisted or misaligned, do not attempt to move it. Pain, bruising, or a bone that appears out of place is a clear sign to stay still and call for help. Once you've done this visual and mental check, it's time to communicate. If you're alone, use your voice first. Call out loudly for help. Shout words like "a help" or "I've fallen," even if you think no one is nearby. Sometimes neighbors or people in another room can hear you. If you have a phone within reach, try to get it without straining your body. Slide or crawl only if you're certain it doesn't worsen your pain. If you wear a fall detection or emergency alert device, press the button immediately. The doctor always reminds his elderly patients to keep such devices nearby. Not as a sign of dependency, but as a shield of independence. If there's someone with you, clearly tell them not to lift you up right away. Instead, explain what you're feeling, where the pain is, whether you feel dizzy or if your vision is blurry. Communication here means sharing information calmly and accurately so others can help safely. The Japanese doctor often says, "Your body is speaking through pain. Your voice must translate it." This step is also where you decide if you need medical help. If there's any doubt, any confusion, pain, or loss of balance, it's better to call emergency services. Waiting for professional evaluation is always safer than risking further harm. There's also an emotional side to this step. Many seniors feel embarrassed or guilty after a fall. They might not want to bother anyone or admit they need assistance, but silence in such moments can be dangerous. The doctor's advice is simple. Pride has no place in recovery. Communicating your situation is not about burdening others, it's about protecting yourself. Even a quick call to a family member or friend can make all the difference. It ensures that someone knows your condition and can check in, and even if you believe you're fine. Checking and communicating are two sides of the same action, awareness and connection. One protects the body, the other protects your safety. When you take this step seriously, you transform fear into responsibility and isolation into strength. After you've checked yourself and made sure there are no serious injuries, the next stage is getting back up safely, and that's where the roll and rise technique becomes essential. Japan's oldest doctor teaches that how you get up after a fall is just as important as how you prevent one. Most people make the mistake of pushing themselves straight up from the floor, but this sudden movement can lead to dizziness, loss of balance, or even another fall. Prevent one. The roll and rise technique is a calm, methodical way to lift yourself safely while protecting your spine, hips, and joints. Start by taking a few slow breaths and confirming that you feel stable enough to move. If your head is spinning or if there's sharp pain anywhere, stay where you are and call for help instead. But if you're steady and can move without pain, begin by slowly rolling onto your side. Use your arms to support yourself, moving one hand at a time so you don't strain your shoulders. Rolling is gentle and helps your body gradually shift from lying flat to being on one side, which reduces the stress on your heart and blood pressure. Once you're on your side, bring your knees slightly toward your chest in a comfortable position. This gives you balance and makes it easier to move into the next stage. Slowly push yourself up using your hands and arms until you're in a crawling position, hands and knees on the floor. Keep your movements small and controlled, and pause if you feel any pain or dizziness. Crawling might seem unusual, but it's the safest way to regain control of your body's center of gravity after a fall. It keeps your weight distributed evenly and helps your muscles re-engage gently. Next, look for a sturdy piece of furniture, something that won't move or tip like a heavy chair, sofa, or table. Slowly crawl toward it, keeping your movements smooth. Once you reach it, place your hands on the furniture to stabilize yourself. Bring one leg forward, placing your foot flat on the ground while the other knee remains on the floor. You'll now be in a half-kneeling position. This is the point where your legs take on more of your body weight, so move carefully and make sure you're balanced before continuing. Using your arms to support yourself, push gently from your legs and lift your body until you're sitting on the edge of the furniture. Take your time here. Breathe deeply, feel your heartbeat, and stay still for a moment. This resting position allows your blood pressure to stabilize. Many seniors experience dizziness or lightheadedness when they stand too quickly, a condition called postural hypotension. That's why the doctor emphasizes this short pause before fully standing up. It gives your body time to adapt. If you feel completely steady, you can slowly stand up by pushing through your legs and using the furniture for support. Keep your back straight, avoid jerky movements, and don't rush. Once you're upright, remain near the furniture for a moment before walking away. The roll and rise technique is not just about physical recovery. It's a lesson in patience, awareness, and body control. Practicing this technique regularly, even when you haven't fallen, trains your muscles to respond calmly in real emergency. The doctor often encourages older adults to rehearse it on a soft surface once a week so that when the time comes, the body remembers what to do naturally. Each careful movement helps rebuild confidence, reminding you that control is never lost. It's simply regained one calm motion at a time. After you've safely gotten up and taken time to settle your body, the next phase is one that many people overlook, yet it's one of the most critical. It's about paying close attention to what your body is trying to tell you in the minutes and hours after a fall. Japan's oldest doctor explains that while visible injuries like cuts and bruises are easy to spot, the real danger sometimes hides beneath the surface. The body can appear fine immediately after a fall, but certain injuries, especially those involving the head, spine, or internal organs, might not show symptoms right away. That's why monitoring your condition closely is a step that can literally save your life. Once you're seated and breathing normally, start by checking your senses. Ask yourself how you feel in your head and vision. Do you notice any dizziness, blurriness, or ringing in the ears? Do you feel unusually tired, disoriented, or nauseous? These small sensations can be signs of a mild concussion or head injury. Even if you only bumped your head lightly, it's important not to ignore it. The doctor warns that for seniors, especially those on blood-thinning medications, even minor head trauma can lead to internal bleeding in the brain. This can take hours or even a full day to show symptoms like confusion, slurred speech, or imbalance. Next, focus on your breathing and heartbeat. Take slow, measured breaths and notice whether your chest feels tight or sore. A hard fall can sometimes bruise the ribs or cause a small internal injury that restricts breathing. If you notice pain with each breath, it's best to seek medical help immediately. He says that balance is not built in the legs, it's built in the mind's confidence that the body will respond correctly. This confidence grows through repetition and patience. Another powerful way to prevent future falls and ease fear is to modify your living space.